Welcome back to Four Eyes, the podcast series that gives you a clear view into the optometry world across Canada and the US. We are your hosts. I'm Dr. Amrit Bilku.
I'm Dr. Deepon Kaur.
Hi, I'm Dr. Ravinder Randhawa.
And I'm Dr. Alex Kuhn.
So this is part 2 of our sponsored episode with I-MED Pharma, talking all about the EYE IRPL device. Our first episode was just released yesterday, so make sure you listen to that before today's episode to learn about what IRPL technology is, how it benefits our dry eye patients with meibomian gland dysfunction, and how it compares to IPL. Today's episode, we're talking with Terrence, who's going to get more into the details of how much this device costs to get in our practice, how much we can charge patients for this procedure, what's the marketing like, and then towards the end of the episode, Deepon and I really go into our personal experience going through the IRPL treatments since I-MED Pharma was kind enough to offer us free treatments so that we can really give our honest opinions. So make sure you listen all the way through and let us know what you think. And don't forget to look in the description box and visit I-MED Pharma to learn more about the EYE IRPL device. Terrence, welcome for coming on our podcast. Thank you so much for being here. Can you tell us a little bit about yourself and about I-MED Pharma in general for any of our listeners who don't know you or the company yet?
Sure thing. Well, thank you very much for having me on the show. I am really excited to be here, especially in the crazy times that we're living. It's too bad that we couldn't be sitting, you know what I mean, in the same room together, but we do what we can. So my name is Terrence Morose. I'm a 26-year-old living in London, Ontario, Canada. And I do work for I-MED Pharma, which is a company based out of Montreal, Quebec, Canada. So I-MED Pharma is an ophthalmic service provider. So we provide a lot of products primarily for dry eye. We used to do some surgical products as well. Recently, we moved away from that and we're focusing just on our dry eye stuff. So what's nice about our company is that we do diagnostics. We usually have an option for every kind of product. So some companies are better known for, let's say, maybe doing a drop or like a certain type of ointment or maybe an omega. But with us as an optometrist, you can come to us to start a dry eye clinic and we have an option for everything, which is really nice. Mm-hmm. Yeah. Now, something else as well is that we also have a protected channel of sales, meaning that, you know, if you're an optometrist, you can retail our products successfully without having to compete against like Amazon, Shopify, different things like that.
And that's why we wanted I-MED to be featured on our podcast, because we also sell I-MED products ourselves at multiple clinics that we work at. And you can really tell the difference in quality of just how your eyes feel after using those products. And it is nice that there's, continuity with all of the products when you're giving that to your dry eye patients. Like you have the mask, you have the drops, you have the lid scrubs, you have the omegas, you have everything. And you guys have IRPL. So we already had one episode about what IRPL is and really getting into the nitty-gritty of how it works. So we really want to ask you questions today on how IRPL would really fit into, you know, the practice for a new grad optometrist or even seasoned ODs who are probably really interested in this. So yeah, we can get started with the first question. When a new technology like IRPL is added to a dry eye clinic, what is the best way to make patients aware of this new device? Or in other words, how do you efficiently market IRPL?
So, you know, for optometrists, first of all, bringing in, you know, an IPL, an IRPL, or an RF machine is still, they're still pioneers in this space. So first thing is that there's not a perfect answer how to market this. I know also optometrists are not necessarily salespeople and they don't necessarily, you know, want to be spending their time giving their patients sales pitches. So to get around that, the first thing I always suggest is talk about it early and often. Obviously, you want to talk about it with the patients that are going to be great candidates for the device, But if you yourself or your staff can be talking about this device, just in conversation or bringing it up, pointing out different posters and stuff like that, it's going to become more common to that patient. So, down the road, that's not going to seem like it's a surprise or it's something that, the doctor is, springing on you to try and make a quick buck or for whatever it is. They're going to be a little bit more comfortable with that. The other thing too is to talk about it with them in the exam rooms. So that's probably going to be the first and most crucial touch point that you're going to have with your patient. Now, I know from hearing feedback from some of the doctors that we work with that have the EI, when you're explaining a lot of this science, treatment, and modality with the device, a lot of this is going to go maybe over their heads, or their eyes are going to probably glaze over. They're probably not going to remember a whole lot. They're going to probably remember bits and pieces of it. So what a couple of doctors do, like Dr. Bahashi, Stony Creek Eyewear Boutique, what he does is he has a couple of screens in his office. So what he does, and I know not everybody has the space for this or maybe the option to have a screen, but if you do, having a visual is really important because this is complex stuff. So any way that you can kind of quantify this to your patients is really important. So if they can kind of follow along and look at something, this is going to help. What's also going to help though is having a bit of marketing material to maybe send them home with. So what we do is we provide a lot of this EI material with visuals and information about how the treatment works, the procedure, the days that you're going to be coming in, and you're going to send them home with this. So we can also customize this, with the logo and the website, the address and the phone number to kind of personalize it a little bit for your patient base and to kind of differentiate yourself in the local market. So by sending them home with this is something that they have in their hands, so they're not going to forget about it. It's a reminder. It's also something that they can go home and read. Chances are is that that's going to reiterate a lot of the information that you've spent in the exam room talking about them with. They may also forget it from there. So the idea is that from there, you also want to have the same information on your website. And you want to have maybe a nice dedicated page because I did communication studies over at Wilfrid Laurier University here in Ontario. So we studied a lot of social media. And something I'm quick to say with people is that even the experts don't quite know why something goes viral and why people really gravitate towards content. There's a lot of really good ideas, and I'm sure that's another podcast for another time. But my point is that you want to invest heavily in your website because chances are your patient bases are probably going to be able to access your website. Like my grandmother was a Google warrior. She could Google everything. Maybe not get to page 2 of Google, but of course, like nobody ever gets to there, right? But still, she would go through the website and she would be able to look through it. The only thing is she's not going to be able to find that information on Instagram or Twitter or something like that. So having that same information reiterated in a few different places, face to face, something physical they can read, and then maybe something digital is really going to help out as well. Any posters, video loops, again, if maybe you have access to that for your clinic, would be really great. And then as well, patient referrals, because if you look at the data from all the EI treatments that have happened so far since its inception, 96% of the patients recommended it to their friends and family.
Wow, that's huge.
Mm-hmm.
Would I-MED Pharma provide any of that, either physical or digital marketing material, if you do have the EI in your office?
So we're not actually the manufacturers of the EI. We're manufacturers of all of our other retail products, which is really great. And that's the reason why, we know our products so well and we make sure that our patients really love our products. But when it comes to the EI, ESW is the company that manufactures this. And so they would provide a lot of this marketing material, a lot of the digital stuff.
Oh, gotcha.
When it comes to actually printing it and providing it with the consumable kits for the device, that's something that we do as kind of a favor for our client base. So we like to go above and beyond for them in a lot of different ways. And one of those ways is understanding that they probably don't have an industrial size printing press in the back room. So we can kind of help them out with that, at least for now.
Yeah, that would be great because it's always nice to have online marketing available too, so people can just kind of plop that onto their website rather than them panicking trying to figure out how to make their website look nice with this new web page on there.
Of course.
No, I really like that idea of using patients as the advocate for these kind of devices. Because if you just tell one patient to kind of go out there and say, oh, if this worked for you, tell your friends and family, word of mouth is huge. So yeah, that's awesome. So are there any patients that IRPL treatments would be contraindicated in?
Yes. So we do have a consent form, which is just among the materials that we would provide to you. So among, the trifolds that we might give to you, you're going to actually have a consent form that your patients would sign and that you're going to keep track of. Just very quickly, though, just off the top of my head, I know that epilepsy, with the bright, quick flashes of light, of course, this is not going to be a treatment good for a patient like that. As well, pregnancy and diabetes. Now, these are two things that this type of treatment wouldn't necessarily really affect these things, but there aren't the studies right now to say that it absolutely does not. So being very cautious with some of these things, for a pregnant woman, they will say probably just to not do the treatment right now, as well as somebody with a pacemaker. Allergy to sunlight, somebody who has had a very recent sunburn, but this would be, I would say, in the last, couple of days, couple of weeks, maybe month at the most. An infection in the treatable area, of course, you would want to wait until that is all resolved. No tanning products either, or food supplements that promote tanning either. And then as well, skin type. So this is very important because, if we were to get into the training and technicals of it right now, I could explain the scale, but essentially we use the Fitzpatrick scale. And the skin mode 6 on it is the one that they say you should not be doing this treatment with. And that's because of the presence of the melanin in the skin. And that can become very uncomfortable and also burn them as well.
How much training would be required for eye care professionals and even clinical staff members to start performing IRPL treatments on their patients?
So this is one of the really, really, really good things about the EI. It is almost foolproof. When I do demonstrations with people and I show them the screen, they're almost shocked at the amount of stuff that they can't screw up. EI does a really good job of
Just
that.
wait till we get it.
I know.
Well, my expert training, trust you, you guys will be experts. But besides that, yes, it is really, really, really simple to use. Like there's all of maybe 3 or 4 different screens that you're really going through. The options in terms of buttons to press are very few. So you can really pick it up, and honestly, the first time looking at it. But usually through the demonstrations, by the time, we've gotten to this point where maybe a clinic is going to purchase this device, usually the doctors have a pretty good understanding of what they're doing. What I would do though is go back and train them and make sure that they are 100% comfortable. With a couple of our doctors, what I've done is I've gone for the very first treatment, and I've just been present for that to make sure that everything goes okay, and obviously all of them do. And because it is so easy to use, a lot of clinics right now are getting the staff to kind of take over before or after. So what some clinics will do is, the doctor will come in and do the flashes necessary, very quick and out, and then the staff member will kind of deal with the gel, clearing it off. And then also this is a really, really, really good time where the staff member can maybe use an expression machine, maybe if you have one, or let's say you're doing a bit of a medi spa, and this is maybe where you want to provide, maybe this is when you're lighting a candle and putting on some music. Yeah, regardless, super, super, super easy to use, and you do not need a certificate to operate this machine.
Oh, nice.
Oh,
Yeah.
okay.
Yeah. And it's been pretty quick too. So like when we have gotten the treatment done on ourselves, it also seemed like the setup was really fast too, just from hearing, like I had the goggles on so I couldn't see, but just hearing how fast the setup was, it does seem like it takes minimal amount of time.
I'm
For
yeah,
the
I'm not gonna lie, it did look really complicated to use. But yeah, like what you're saying, the setup was really fast
Yeah.
and the whole process was pretty fast.
Yeah. I think
Um,
the only confusing looking part was when I know my rep Adam, when he did the IRPL on me, it's just plugging it in because you
yeah.
have to take it out of the briefcase. So it's just like plugging in all the parts. I was like, whoa, this looks like an octopus. Like, what is this? Like, too many
Wand in the
places to
arm
put
that
things.
comes around. Yep.
Yeah.
Yeah,
But I
and then
guess once
putting
you
it
have it
back
set it
in the
up,
briefcase, that
yeah.
that
Once you
seemed to
have
be
it set up, then
complicated.
of course you're not, taking it apart every single time
Yeah.
after a patient.
Yeah,
Yeah.
exactly. And at least for size compared to some of the other IPLs out there, it is pretty decently sized. You can cupboard it if that makes sense. It's also pretty small that you can put it on a little wheelable cart if you want to do that, or maybe stash it away. So in terms of like size, it's not bad like that either. And I know it probably looks very complicated, but essentially, the I would say the most difficult part about the entire thing is just essentially applying your gel, because sometimes you're going to have a bottle with only like a little bit of gel left, so you're trying to slap it so that it all gets to the bottom, and you're still going to get that that ketchup squirting bottle sound, but that's really the worst of it.
Yeah. Yeah, my rep definitely experienced that a few times when we were doing this on me. But just to get on the more of the money side of this device, how much is the total cost of the IRPL device?
So currently the EI is $56,995, and that is obviously plus tax. Now for an additional $10,000 as well, what we offer is an unlimited kit package. So for the first 5 years, we provide as many consumable kits as you can go through.
Wow. How many flashes would you get in one use before you have to buy another replacement?
Yeah. So what's nice about this, like this device compared to a lot of other IPLs, it is much more concerned with the quality of light. So with any type of device that you're using, if you have a dedicated piece of tech, that piece of tech is probably going to need to be maintained after a certain number of years or consistently or whatever that is. Now, because the EI uses consumable kits, because it's very concerned with the quality of light, it's going to be using consumable kits because it wants to replace that bulb each single time, right? To make sure the quality of light is the same for all the treatments. So with each single bulb that you get, and this is part of the consumable kit. So you're going to get your bulb, you get maybe a couple extra goggles, let's say if you lose it or sit on it. Or you would also provide the ultrasound gel to you as well, marketing materials, kind of all together in one. But with that bulb is going to come an activation card. Now, together with these two, there's 500 flashes. 10 is going to be done per side, 10 per patient, 5 per side. And so you're going to be able to do 50 patients.
Oh, gotcha. Yeah, that's still pretty good. That's a lot of patients for one bulb. Yeah.
And the thing is with the consumable kit, a big reason why people have gone with it, and actually every single person so far that has purchased the device with us has purchased this consumable kit. And the reason being is when you don't have to count out the flashes and your margin per head, you can administer a couple of extra flashes. And because this has the same IPL technology that a lot of the other devices have, plus the IRPL technology that it has, you can still get some cosmetic results as well. So when you have done unlimited flashes, you can do those extra flashes. Now, I wouldn't say to your patients, you're going to make them look 10 years younger, kind of let them stumble upon, those effects. But yeah, so far people have seen a lot of freedom with it.
Yeah. And going back a little bit to cost, now that we know how much the machine itself costs, what factors do eye care professionals need to consider when they decide how much they should be charging for each IRPL treatment?
Yeah, so a couple of things, and I know this is it's a really interesting spot for an optometrist to be in because, like I mentioned before, they're probably still a pioneer in their city for bringing in a device like this. So something that you want to do first is you want to check out your local market. So you want to see competing devices, right? So these could be other IPLs, RF devices. Essentially, you want to get a good idea of the other dry eye services that other clinics are providing, and kind of get an idea of who's around you, how close, and maybe how much overlap your demographics or patient bases might have. Now, something else as well is you can check out their website. You can maybe try emailing them or reaching out to them via phone number if you know them personally, or maybe just, one professional to another. As well, considering your own demographic and your own patient base. Of course, if you're going to be in a little bit, let's say maybe more cottage country in Ontario, you might charge a little bit less than maybe if you were, downtown in the heart of Toronto. Right? So knowing your demographic, who they are and what they're likely to pay for is really important as well. Something else to consider when you're building out the cost structure of a treatment like this is going to be your value adds. So, just doing an EI treatment is great, but what a lot of people are having success with are providing value adds in the treatment. And what I mean by this is this could be additional devices that people are using. So I know there's a couple of people actually in London that have just picked up the EYE optometrists on Colborne and View Vision Center. One of them has a LipiFlow, one of them has an iLux. So basically, they've picked up both of the LipiFlow and the iLux before the EYE, and now the EYE is kind of that final puzzle piece that's bringing it together. So if you have a second device, you can and should charge a little bit more. If you have, let's say, an expression machine like Dr. Bahashi, then perhaps you can provide this as a service directly after or before as well for this treatment. So this is something that the staff might do. Dr. Bahashi will probably do the treatment himself. The staff will maybe come in and then maybe use this device. So this is a great opportunity if you have a clinic and let's say you picked up a device or a diagnostic tool for whatever reason before, and let's say you weren't able to integrate it into the clinic you really wanted to, and maybe just didn't quite get the ball rolling on it. This is a really good opportunity to bring that back into the fold and build that into your cost structure, which is really nice. Now as well, I mentioned just now diagnostic tools as well. If you have a diagnostic tool and let's say you have like a keratograph or something like that, something that does mybography or a tear check, something similar to that, you're probably also paying that off. So you probably also have fees associated with that. So you got to be conscious of that, building that in as well, and then maybe charging a bit more for it too.
Yeah. I guess it's really just like, yeah, if you have more than one dry eye treatment available to your patients, that's not an artificial tear at that point. Like that is like a dry eye clinical experience. Like you're giving them, a bigger package with all of the treatment options that address all of the factors of dry eye, which is great. I guess, yeah, that is the easier way to add value to how much you're going to charge for each treatment with the more things that you add on, right? Yeah, that makes sense.
Yep. And then also too, let's say maybe some really nice reps have come by and dropped off, a ton of samples. And let's say you've just got a cupboard full of drops and wipes and omegas and masks and a whole bunch of stuff. This is also a good time to start using those, providing those to your patients. Maybe you can charge them for it as well. This is also a good chance to get them to try some products. If you maybe say, hey, I'm going to give you, an eye drop MGD after you're done your treatment or with your very first treatment, and then you can start to use this product as well, because that's just going to help things more.
Yeah. Yeah. Actually, yeah. The nice thing about I-MED Pharma that I like too is that you guys have these MGD kits that you can also give, right? So you have these little zip up bags that you put in your lid scrub, your MGD drop, your heated eye mask, the vitamins. And yeah, I just feel like when you're adding all these things together and it's all with that one brand name or brand logo on there, it really makes you guys feel like, or it makes patients feel like, oh, this is my one-stop shop for all of my dry eye treatment. And I'm getting the whole package. I'm getting the EI, I'm getting the MGD kits, I'm getting all the other products, I'm getting the treatments. Yeah, it just makes it so much easier for patients to get all of their therapy in one area, which I really like too. I like the consistency that one brand kind of has it all, which is really nice.
Yeah, we have a schedule card in there as well, because I know compliance is, toughest thing with any patient and any health.
That's nice. A schedule card? Yeah.
Yes. Yes.
It's like our VT homework sheets. You just check off each day that you do your stuff.
Exactly. And easy for the patients, absolutely, because again, they just open up that kit and, even if the most basic logic is just use everything in front of me, then that's great. They're going to get something out of it at least than just keeping it in the cupboard and not using it, right?
Yeah.
The other thing as well, nice for a clinic to be able to say, here's a package, use this.
Yeah. Like you have everything now.
Yes, we've given it all here. I can safely sleep at night knowing, you have an omega in there, you've got a mask, you've got a drop, you've got a wipe. I'm doing as much as I can here to try and get you in a better place.
Yeah, so true. Yeah. What would be the best way for eye care professionals to maintain the IRPL device so that it can be used long term?
So it is a very, very, very durable device. Not that I've dropped it. No, I'm kidding. I definitely haven't. Um, but it is very, very, very durable. If you were to pick it up and hold it, like you can tell just from the quality of materials when you're holding it, it's not going to fall apart on you. I wouldn't say go bowling with it. Definitely keep it away from water as well. So when you're disinfecting it or cleaning the device, this would be the point where you'd want to spray the cloth versus maybe spraying the handle or the device itself. Just, little tiny things like that can always help out. Not ripping the plug out of the wall before you kind of power it down. I just know that from all electronic devices, with my gaming systems, over the years being a kid and whatnot. Yeah, it's a fairly low maintenance device, which is really, really, really nice. And again, it's another selling feature of it.
Yeah.
Terrence, is there anything else eye care professionals need to think about before implementing this device into their clinic?
Sure thing. Yeah. Just for just to speak to cost too, getting into it and like what to like actually charge the patients for like dollar amounts. At least in my area of Ontario right now, and remember, I don't see downtown Toronto, but for right now, it seems kind of on average, people are charging about $800 to $1,000 for a 3-session package, and it is important that they do that 3-session package. You also sell it to them as the 3-session package because this is a treatment where somebody can, if they have a full set of glands ready to get back to work, they can possibly feel a lot of symptom relief right after that first treatment. And if they're, anything like my dad is a little bit old school who thinks, oh, I'm feeling better, I beat the system, I'm smarter. Yeah. I can keep out on this money or whatever it is, that's going to go away after a week. So you want to make sure that you're selling it to them in that session so that they're more inclined to come back for that second and third treatment. Like I mentioned before, if you're going to use, 2 devices, I don't really have an average on what people are charging for that. That's kind of up to them. But it is definitely more. If they have 2 devices, they're definitely charging more for that.
Yeah.
And then also too, you can offer possible maintenance sessions. So let's say they've already done their 3 sessions, and let's say maybe in a year, they've gotten a good year out of it, or maybe it's a year and a half or 2 years, they'd like to come back for one more treatment, then you can charge them for maybe $400 or $500.
Yeah.
That's completely also up to the doctors, what they want to charge, the fees associated. So yeah.
Yeah, that's great. Thank you, Terrence. You answered all of our questions with so much information. I'm really excited for any of our listeners who's listening to this episode and the one prior to this about the EI and the IRPL device. I mean, it would be really exciting to see how many people will start to implement this in their practice, because it is really nice when you can give dry eye therapy as a complete package for your patients, especially all from one company. And the reps are great, at least from us. Our reps are great. So it's definitely a company that we love working with too. You guys are so easy to reach, so comforting to talk to. You give us so much information all the time. So yeah, I would definitely, I think we all recommend anybody listening here to check out I-MED Pharma, check out their products, consider the IRPL device, because yeah, you're right. If you're selling at least 3 sessions to each patient, you are going to pay off that device after a while. Like it's going to pay off because you're locking in that patient for at least a couple of sessions, that they can't just take one and run away.
Yeah.
And, we were lucky enough. I-MED Pharma was really generous and gave us, me, Deepon, and Rav free IRPL treatments. 3 sessions total, but I think I've only had 2. I don't know, Deepon, how many?
I've only had 2 as well.
Yeah. Yeah. Because we're still spacing it out. And you guys have been so generous with us, letting us try that so that we can give our honest and personal opinions on the device as well and the treatments. Deepon, do you want to share your experience? Because you started before I did. So you've had it done longer than me.
Yeah. So I have mild dry eye. And then when I first did the treatment, the only thing I had to do or prepare for it was I didn't wear any eye makeup or anything. And I did have to take out my nose ring. That was the only thing. And then, when I started, or when the ultrasound gel was being put on my face, when that was put on my face, it just felt like a facial. And then I was like, all right, I could just sit here all day and do this. And then, so that was really comfortable. when the actual flashes of light were happening, it just felt like quick sensations of heat. It wasn't painful for me. It didn't feel uncomfortable at all. I literally told my rep Ben that, you know what, I could do this all day. So if you
Yeah.
want to stick around and do that, that's totally fine. I'm okay. One thing I did notice for sure though is I did my second treatment on the 15th day, but I didn't really reach for my eye drops or anything for those 2 weeks. And I usually use my drops at least about a couple times during the day. So that's one thing I noticed. So that was really nice. And then I kind of started using my drops by like the 13th or 14th day until I got my second treatment. And it was the same thing again. It was really comfortable, fine, good, no
Mhm.
pain, nothing there going on. And yeah, it was good. I recommend it. I loved it. And I'm trying to convince my current clinic owner to get it. So I'm all for it. I'm on board for it. And I
Yeah.
really enjoyed it. Yeah.
So you felt like you didn't need to use your drops though after your second treatment, not the first
After
one.
my first and second
Oh,
treatment,
wow.
actually. Yeah. So, but my dry is pretty mild.
Mhm.
So I felt, pretty good after the first one. I also got my glands expressed and it felt great. So yeah, there was not major issues for me. But I know Amrit, your dry eye is a little bit more severe than mine. So
If my rep Adam is listening, I felt really bad for Adam because, he was really excited. He really hyped it up. And I was like, listen, my eyes are really, really dry. I don't think I have low expectations for IRPL. I
but
don't
that is the
think,
typical dry eye patient though, right? So
yes.
you're like perfect for this.
Yeah, yeah.
Yeah.
But I mean, the thing is, I'm really skeptical of anything because again, I've tried 15 different brands of artificial tears. I've taken omega-3 since I was like 16. I've taken flaxseed oil since I was 16 or 15. There's so many, and I've had the heated eye masks. They just burn my skin because I put them too hot. So like everything's just nothing was really working as much as when I started to use the I-MED drops. I kid you not. I know the drops for sure were life changing for me, especially the gel one. It is the only gel drop I've ever experienced in my life. And we will probably have a whole episode about this gel drop because it does not blur your vision when you put it in. So I actually use that during the day. But so, yes, my rep was really hyping up the IRPL. After the first treatment, I felt the treatment itself was really good. I agree with Deepon. It felt like just someone was just putting a blow dryer like over your closed eyes for a couple of seconds at a time. So the heat level isn't that bad.
Mhm,
It's really comfortable, and you just feel like you want to fall asleep.
mhm.
But after the treatment, the first one I felt the exact same, and Adam was like smiling, like so. I'm like, no, I feel the exact same. I'm still dry. But after the second session, I think Adam's hopes were down too because he's like, all right, let's just get this over with. You won't feel any better. But I swear to you guys, I couldn't feel my eyelids or my eyes after that second treatment. Like I was so hydrated that I don't know what that feels like. And I was like blinking constantly in front of him. I'm like, I don't understand what's going on. I don't feel my eyelids rubbing against my eyes anymore.
You
And
don't feel that friction
I don't
anymore.
feel that friction. Sometimes
Yeah.
I can hear it too. It's really bad. Yeah. But no, it was amazing. It did last for I'd say at least 2 days. 2 days
Mhm,
I felt like I didn't have to use my drops as often in the morning or after work when I drive home. But I mean, now it's been a week. Now I still kind of feel back to the same. But I do believe now that if I do my third treatment and then probably maintenance treatments, I think my symptoms would likely be less than what they are now, which is
mhm,
still really good. For a dry eye patient, any level of decrease in my symptoms is always a win, even if it's like not 50%. If it's a 20% reduction, I'm still happy.
mhm.
So yeah, it was still good. I really do recommend more ODs to contact their I-MED reps and try it and try that for your dry eye patients. I think it's definitely a great option to add to all the other treatments that they're already doing, because why not? It'll bring their symptoms down even 10%. That's still better than nothing.
Mhm.
That's awesome. I'm so glad to hear that it's worked out well for both of you. What makes working for a company like I-MED and working with a product like the EYE so easy is because I hear things like this from real people after doing the treatments with them. Also, to what you've both said, falls in line with what we've seen with a lot of people. So some people do say right after that first treatment, like their glands are probably, like Deepon's glands are probably a little bit, she probably has more of them, maybe some of them kind of not as many of atrophy maybe. So they're going to get back to the work. So that makes sense. But I would say after that third treatment, you're probably going to notice the biggest difference. And that's where, when you look at the data, that's where everybody sees the biggest difference as well. So I'm excited for you to do that third treatment and to hear how you feel.
Oh yeah. I'm like counting down the days. I already told Adam, like right when I took the goggles off, we opened up my schedule. I'm like, when are you coming back? Make sure you come this time.
Yeah.
Awesome. Well, I'll pass on the feedback to him. I'm sure he'll be really happy to hear that. Yeah, that's fantastic.
Yeah, thank you again, Terrence, for giving us all the information about the EYE IRPL device. We'll add all the information in our episode description box for anyone who's interested in learning more about it. And we're looking forward to chatting with you again sometime in the future.
Awesome, for sure, absolutely. Next time, just let me know and I'll be back.
Thank you to everyone for listening to Four Eyes. If you enjoyed this episode, please be sure to subscribe and leave us a rating to give us feedback on how we're doing. You can also check us out on Instagram at 4eyesoptom for more content. Look out for new episodes every Wednesday. So until then, stay tuned.